Good evening. My name is Dr. Phil Frank Bandera, and tonight we're going to talk about sports hernia. So there's a lot of controversy in the medical field about sports hernia, about the term sports hernia, because first off, it's really not a hernia. There's no disruption or defect in the abdominal wall. And secondly, you don't have to be an athlete to suffer from a quote-unquote sports hernia. While a lot of athletes suffer from it, you can be a non-athlete that gets it. So you don't have to be an athlete, and you don't have to be involved with sports, and there's no defect in the wall. That's why there's a lot of controversy. There's a lot of terminology that gets thrown out there in regards to a sports hernia. You see a lot of professional athletes get diagnosed with it when you see reports online, on SportsCenter, and what have you. The two terms we're going to focus on today, just so I can give you guys some information about what exactly it is when they're talking about these things, is first is inguinal disruption, and secondly, athletic pubalgia. So I drew a very rudimentary diagram to kind of help explain this. Hopefully you can make it out. This is the right hip bone, the right pelvis, if you will. When you're talking about inguinal disruption, you're basically talking about when the tissue, the soft tissue, gets compromised with the inguinal ligament, which runs down the pelvis and comes down to the pubic bone of the pelvis, or the conjoint tendon, which is where your transverse abdominis and your obliques attach at that point. There's a lot of force that gets transferred across that ligament when other muscles contract around it. We'll touch a little bit on that. And then the other term we talked about is athletic pubalgia. Athletic pubalgia happens and refers to when the adductor aponeurosis, that's like a thin tendinous sheet of the adductors. They come along the inside of your leg. The tendon forms into a sheet of thin tendinous material that attaches to that pubic bone there as well. So if there's a strain or compromised tissue of that is referring to athletic pubalgia, and broadly referred to as a sports hernia. As you can see, there's a lot of forces that are getting pulled against the pelvis with these. So you can have the rectus abdominis pulling in this direction, you can have your adductors pulling in this direction, and the inguinal ligament provides a stabilizing force in this direction when your abs contract and when your adductors contract. So if you have forces pulling in three different directions, you can see how this can be a compromised area for injury and how it's easily injured from doing sports activities and non-sports activities, athletic activities, lifting activities, what have you. The hallmark signs of either inguinal disruption, athletic pubalgia, sports hernia, can be a deep groin pain, and again, you can see with this pulling here, this pulling there, that pulling there, that deep groin pain will be up in here. Occasionally you can have lower abdominal pain. The pain can be worse when you're doing athletic activities like sprinting, cutting, changing direction, maybe sitting up in bed, maybe picking up something heavy up off the ground. But the pain you feel will be relieved when you're at rest. So when you're not doing anything to compromise that area, you're not feeling pain. Nothing's getting pulled on that area. Symptoms usually are worse when you're doing some kind of like twisting of the leg, kicking of the leg. Maybe you're sneezing, you're tensing these muscles up when you sneeze, or if you're getting in and out of your car because you're twisting, bending, and doing a weird motion, or maybe getting in and out of bed as well. This pain can have an insidious onset. Usually it'll happen like out of nowhere. You're like, where did this pain come from? There are instances where you may actually feel something happen. You're like, oh, I have pain deep in my groin, or deep in my abdominal area. So when you have this, what do we do? How do we treat it? What's the best course of action? The studies that have been done for conservative treatment, that's non-surgical, non-operational treatment, have shown that if you do 6 to 8 weeks of physical therapy, conservative treatment, non-surgical treatment, you can actually get really good results from that. So our our goal as physical therapists is to save you a trip to the operating room. We don't want you to have to waste your time, waste your money, put on all that aggravation for scheduling surgery, going through it, and recovering from it. So I'll go over some things you can do as part of conservative treatment when you are having these type of symptoms. First and foremost, rest, relax. If you're doing something that's causing you to have this deep groin pain, stop, take a break from it. If it's playing recreational soccer, if it's lifting heavy loads of mulch, whatever it may be, give yourself a break from it. Maybe get help to do it. Rest is so important, and it's something I stress to my patients a lot, because if you just keep working away, pushing through the pain, it's not going to get any better. It's just not. So 2 to 4 weeks, I would say, for conservative treatment before you don't see a change, and then maybe you see a doctor, an orthopedic surgeon, or a physical therapist. So what are the things I actually want you to do? We'll go over some gentle stretches, and I really want to emphasize the gentle part of that stretching. So basically, I'll go over some stretches with you. First, we're going to stretch our hamstrings. When you stretch your hamstrings, if you have a strap, that's great. If not, you can use a towel. If you're really desperate, you can just pull your leg up with your hands. But let's say you have a strap. Lying flat on your back, you can stretch your hamstrings, pulling straight up. You should feel that stretch right in the back of your thigh. With these stretches, with most stretches, I like to tell patients do it for a 30-second hold, repeat it 3 times. The next thing we'll do is a butterfly stretch to stretch the adductors gently. And I really want to emphasize gently again, because we're stretching the area that's compromised, so we don't want a lot of pull on that muscle that has their insertion compromised. So here, I'm getting into that butterfly position. I'm letting my soles of my feet touch together, letting my knees gently come to the ground. And just getting in this position may be enough for you. Maybe you need to pull yourself forward. Don't pull up on your feet, but pull yourself forward slightly. Feel that stretch, and then relax it after 30 seconds. With stretching, I also like to emphasize is don't pull to pain. Pull to feel that tension, that pull, that stretch. If you feel pain with the stretch, back off. You should just feel the pull. You shouldn't be causing yourself more pain with the stretch. The other adductor stretch you can do for the inside of your leg is in a kneeling position. You're here, and you'll bring that leg off to the side, like that. And then you may need to lean. This is something you may need to play with a little bit. So maybe you lean away from it, maybe you lean towards it, maybe you sit back, maybe you rock forward a little bit. When you find that spot where you feel that stretch, and for me, I feel it right here, right on the inside of my thigh there, and that feels nice, and I'm going to hold that for 30 seconds. Next, we can do a quad stretch, sideline quad stretch. You simply grab the side of your, or grab the front of your lower leg and pull back, and you'll feel that stretch in your quad. And then for a hip flexor stretch, your hip flexors are a little bit higher up than your quads are. You can get into a kneeling position on one knee, right here. And what you'll do is try to rock your hips back and give it a slight lean forward, and you'll feel it in the leg that has the knee on the ground. So if you needed to stretch your left leg hip flexors, you would have your left knee on the ground. And I feel a nice stretch right in here for me. And we're holding that 30 seconds. So those are some of the simple stretches you can do. These really don't take up a lot of time. You can do them once a day, twice a day, work it into your work schedule. What are some of the exercises we could do? Very gentle exercises. So the first thing we can do is a prone plank. We want to do a contraction of our transverse abdominis. So looking at this picture again really quick, you have your rectus abdominis. Those are your six-pack muscles that everybody likes. Underneath that, deep to those muscles, is the transverse abdominis. These are important muscles because if they're weak, your core is going to be weak, your hip control is going to be weak. And if it is weak, that might have been one of the factors that led up to having a quote-unquote sports hernia. So prone plank, real easy. You're going to be in a position on your stomach. Feet are planted firmly on whatever surface you're on, and then you're gonna lift your hips up off the table, keep in a straight line, and we're gonna hold this. How long are we gonna hold this? Everybody's gonna be different. Some people can hold a plank forever. If you're not that person, see how long you can hold it. Count in your head, maybe set a timer on your phone, and let's say you last 20 seconds. Your goal could be to beat that 20-second mark. Next. So our goal with this strengthening exercise is to strengthen the muscles around the hip and strengthen all the muscles that are around the adductors, the abs, so that you have more support for the muscles in that area. So next we're going to do a side lying hip abduction. That's just when you're lying on your side. And now we're training the muscles on the side of our hip. You're going to lift up, pause, slowly lower. It's real important that your body's in a straight line, that your hip isn't too far back and too far forward. You want to keep that hip pointing straight up in the sky, lifting up, pausing, slowly lowering. I like to have patients start off with 3 sets of 10 of that one. Hip extension on your stomach. Right here, you can lie really flat if you want. You can be up on your elbows, lifting up, getting that hip extension. If you wanted to make it harder, you can do a prone plank, as I already showed you, and then do hip extension. Always keeping it in control, never slamming our feet down on the ground. Controlling the way up, controlling the way down. Pelvic tilts. So the easiest way to start with pelvic tilts is to do them standing. A lot of people do not have good pelvic control. Usually guys are worse at it than girls. So it may take a little bit to master, but the first thing you want to do is feel where your hip bone is at. And you can feel the top of your hip bone. I like to place my hands there because it gives me a feel for where my hip bones are. And then you just want to rock forward, rock them back. Rock forward, rock back. And it should be nice and smooth, nice and slow. As you get better at it, you can sit on a physio ball or Swiss ball and do it on top of that and really feel a good tilt on the ball, getting control. You can do a bridge, a supine bridge on your back. Lying on your back, pull your feet up to your butt. Arms are on the table. You're going to push your hip and your butt up off the table. Hold it there. And then slowly lower. Come up, hold it there, and slowly lower. Again, 3 sets of 10 of that. And then lastly, getting control of your body via single leg balance. So maybe you had poor balance, poor proprioception, a poor kinesthetic sense of where your body is in space, and maybe that's something you need to work on. Maybe that poor balance is what led you to have some of these symptoms that we've talked about. Real easy, find an open space, find something that you can balance on if you need to, and we can do single leg balance. And then if that is way too easy for you guys, find a pillow that you won't get yelled at if you stand on at home. Don't you dare grab a nice pillow. Get that pillow, you can fold it up if you need to, and now you have more of an unstable surface to balance on, and it'll be a little more challenging. So I said before briefly, try these exercises for 2 to 4 weeks, and if they work, excellent, I did my job tonight with this video. If it doesn't work, it's not the end of the road. Maybe you go in and see a physical therapist, like us at Total Performance Physical Therapy. Maybe you go see your general practitioner, maybe you go see another doctor, an orthopedic surgeon, and they can direct you. You can tell them, hey, I tried these exercises, they didn't work, what's the next step? And then that's a conversation you can have with your doctor, with your physical therapist, and you can move on from there. Sometimes conservative treatment doesn't work, and that's the reality of the situation, unfortunately. But like I said, if it does work, great. If you needed to get surgery for it, again, don't fret. They are successful operations. You can get physical therapy once you're done with that, and then you'll be back into your regular life. I hope this video was informational for you. I hope you got a lot of good info from it. Please give us a call at Total Performance Physical Therapy. Stop on in, and we'll help you with this or any other problems you have. Have a good night.